And right now we're gonna have Dr. Cassandra Bolar. She is Dr. Cassandra is has a heart to see families flourish and thrive. For over 13 years, she has been engaged in community-based programming and research efforts that focus on improving outcomes for children and their families. Clinically, she is passionate about serving marital couples through therapy and relationship education, and she created the Marriage Head Start premarital curriculum. She has also had an opportunity to examine the public health implications of healthy relationships at Morehouse School of Medicine, Such a Health Leadership Institute, and she received her bachelor's degree in child and family development from the University of Georgia, and her master's and doctoral degrees in human development and family studies from Auburn University. She holds a certified family life educator credential from National Council of Family Relations, and she serves as a marriage and family therapist. Cassandra resides in Smyrna, Georgia, with her husband Ronnie and their two children, Jeremiah and Joy. So, Dr. Bolar, thank you so much for being here, and welcome to the Kingdom Health Summit. We are so excited to have you here, and I know that it's going to be a blast. So I give you the floor.
All righty. So I just want to say thank you so much for this opportunity. First, I'm just grateful to be here, and it's just such an honor. I pray that whatever I share is helpful, and I want this to be conversational. I want this to be meaningful to everyone online. And so first, I want to start off with a question, and that question is: when you are thinking about maybe the most distressful experience that you've had that has impacted your mental health, did it include a family member? Did it include an intimate partner? And if so, did that occur early on in life? And, the reality is that for a lot of us, it did. It may have included a family member or someone early on. And so what I'm going to do is I'm going to share my PowerPoint here, because I'm going to be focusing primarily on how healthy relationships and marriage in particular, how that the role of healthy marriages in protecting the mental health of future generations, okay? And so we'll go ahead and move right along. So as an overview, I want to really talk about the protective role of marriage for children's mental health. Essentially, why does marriage even matter? What do we see as the current trends as it relates to marriage and childbearing here in the United States? And everything is from a kingdom perspective. And I'm so grateful to be here and be able to talk about all of these concepts from a kingdom perspective, because truly a marriage, family, all of that has been some institutions that were instituted by God. And then we're going to talk about what ACEs are and how healthy relationships and marriages, how they protect against the experiences of ACEs, which are adverse childhood experiences. And as you heard before, Dr. Carl has done an amazing job. And as he was saying before, the enemy doesn't fight fairly. A lot of times he's coming during early development when it comes to family of origin issues, but we're just going to see how can we kind of safeguard and not be ignorant of the enemy's devices when it comes to the family unit and that foundation and what marriage provides. Now, before I even go into this presentation, I just want to give as a caveat, here's the thing. All of us may not be in a marital situation. Some situations, it may not even be ideal for the couple to be together, but I just want to talk about God's kingdom design. And that doesn't, put down anyone else's situation, but I just want to highlight and bring to the forefront just the power of God's design, all right? And then we'll talk about really kind of the strategic goals, because really, if the battlefield is the mind, the play field the current battle right now is against the family. And so we're going to talk about some of those strategic goals of the enemy to undermine marriage and what he is trying to do. And then also, too, what can we as clinicians, what can we as practitioners do to promote healthy child development, as well as supporting healthy relationships and marriages. And then looking at it really from a broader view to examine, what can we do on a kingdom level? All right. So I'm going to go ahead and dive right on in. And, essentially, why does marriage matter? Right. So the research is very clear. So Harvard is currently conducting about a 76-year longitudinal study. So they've had various different primary investigators. This is a very long-term study, right? Even President Kennedy was a part of this study. And what they were doing was they were looking at what really predicts health and happiness and longevity across the lifespan. And what they found was that it's those close, loving relationships that predict health and happiness across the lifespan. It's just as important as what we are eating. It's just as important as exercise. Having a close, loving relationship. All right. So we see that when people are in the context of a healthy marriage, they live longer. There's a promise connected to doing things God's way. Also, too, we do see better mental health outcomes, better physical health, higher lifetime income, even when compared to people who have been cohabiting for the same length of time. There is a special it factor when it comes to wealth accumulation for married individuals, and I think is the favor of God, and I think is His blessing that He has on for marriages. And then also too, we see that the social networks are often broadened, and also too, we do see some gender factors as well with respect to the marriage advantage being even more robust for men. Right, with respect to living longer and also increasing their social networks as well. So now in looking at children, when compared to other family structures, even though marriage, contemporary marriages, when compared to, marriages historically, we do see that the marital structure is the most stable family structure when compared to other family structures, whether it's cohabiting, live-in partner, or what have you. It is still the most stable family structure. Also, too, we do see that fathers are more likely to have a co-residential status with their children when they are married to the mother, and there are a host of advantageous developmental outcomes that we see for children emotionally, academically, socially, when it comes to a lot of those academic outcomes. And also, too, we see that it reduces the likelihood of living in poverty, and it also gives those kiddos access to larger social networks and support as well. But, it even broadens beyond, the children involved, but also looking at, on a societal level, what do we see at that level as well? And, even as at a societal level, we see that, next slide, please. We see more social stability, and improved quality of life for the entire community, even lower crime levels. When there are more married couples in the community, we see a lower likelihood of crime within that area. Also, too, better economic outcomes for that area as well. So now let's kind of shift gears. What are we seeing when it comes to the trends? And I think that this is, I think we cannot sit back as kingdom citizens and just say, well, this is the sign of the times and things of that nature, and not mobilize ourselves to bring in awareness and work for change. Because what we are seeing is it is unprecedented with respect to the low marriage rate in the United States. It is the lowest that has ever been historically. Okay, when we're looking at young adults ages 25 to 34, back in 1965, about 90% of, people who had a high school diploma or less, and, bachelor's degree, it was actually about close to 85% were married, okay? Compared to 2010, about 52%. Under 52%. It's actually about 43%. And, historically, education, people who are more highly educated back in the 60s were less likely to get married, but we've actually seen a crossover and a change whereby, being more highly educated, you're actually more likely to get married. But what we're seeing is that this is only hovering around 50%. Do you see how much of a decline that we've seen in marriage? And this is very problematic when we're thinking about the protection that marriage provides for children, right? And so we're going to dig a little bit more deeply in that in just a moment. But moving right along, not only do we see a crossover effect with respect to the impact of education on one's likelihood of getting married as a young adult, but we also see a great crossover whereby the age at first birth on average, for the first time in history, around the early 90s, for the first time in history, on average, women in the United States are having their children at earlier ages than they are getting married. And this goes along with the trend that we are seeing with respect to people are getting married at later ages. Now, a lot plays into that because we are no longer operating in a manufacturing economy, right? So we are currently in a knowledge-based economy whereby it takes longer to be competitive in that economy. And so it takes, with respect to getting a higher education. So what we're seeing is that people are delaying marriage, but interestingly so, they are not delaying sex. And even with the research with respect to, a lot of times, on average, age at first sexual intercourse is maybe about 16 years old. So and age at first marriage has gone up to about 27 years of age for women, about 29 years of age for men. So what we're seeing is that young people are experiencing about a decade's worth of sexual engagement prior to marriage. And even the research points to how having multiple partners is problematic to marital stability as well as satisfaction. And a lot of times the research it just proves what the Word of God shows, and so we're seeing this crossover effect. So based on the numbers, people are less afraid of having children than they are of getting married. And if you want to take a little bit more, a deeper dive into this, because I have a limited amount of time, but if you want to take a deeper dive into looking at these statistics, you can take a look at the Not Yet report, KNOT report, right? Okay, so we're going to move right along as well. So I want to talk about, okay, so we see all these trends when it comes to marriage, right? We know the protective effects that marriage has for the children involved, for the adults involved, how it even impacts their own mental health. And so this study that was conducted by DeClean and others, they were looking at the Fragile Families data set that was following about 5,000 children in the United States, in cities that had kind of relatively large cities. I think the cities had to have at least 20,000 people in it, right? And so what they found, they were following these babies, I think they still are following these babies and their families, to see, the impacts of, different experiences early on, how it, impacts children's development. And so they were looking at the mental health based on relationship status of the parents. All right. And so what they found in this research was that marital status had a huge bearing on mother's mental health as well as father's mental health. So let's just take a look and see what they found with respect to mother's mental health in comparison to father's mental health. All right. Now, I know sometimes these graphs can be a little hard to read, but I'm going to help you read them. Okay. So if there's an X beside the number, that means that was statistically different and significant from married couples. That difference was significant. All right, for married couples. If there was a Y, that means it was statistically different from cohabiting couples. And then Z, it was statistically different from non-cohabiting couples. So the various different relationship statuses that they were looking at married couples, married individuals, cohabiting individuals, non-cohabiting individuals who were still romantically involved or no longer romantically involved. Now let's take a look at this. Right? So looking at a major depressive episode. This is not just baby blues. They were assessing this data a year after the babies were born, right? So for this study in particular. And what they found was that for a major depressive episode, as we see here, married women have the lowest number. They have the lowest incidence of major depressive episode. We see that for married women, but for non-cohabiting and individuals, it was statistically significant. Their higher number, so they were more likely to experience major depressive episode, and it was statistically significant. And even above that, for couples who were not living together and they had no romantic involvement, meaning that they were just cohabiting, theirs was even higher. All right. Now, and we see similar illicit drug use, more likely if you're no longer romantically involved, and more likely if you're non-cohabiting, but you're romantically involved with that partner. Now, interestingly so, we do see even for men, we see the same degree. Look, it's 6.8 major depressive episode for a married father compared to 21.6 for a father who is no longer romantically involved with the mother. Okay, and so you can see that even we see differences for illicit drug use. We see differences for drinking. So what we see overall is that both mothers and fathers, we see a differential based on this research for mental health outcomes and illicit drug use and even drug usage based on marital status. And it appears that marital status is a protective factor for those couples. Okay, so let's move right along again. And now let's look at it. Now let's look at kiddos and what we are seeing when it comes to their entry into an emergency situation when it comes to their mental health, okay? And so this is from the American Pediatrics Association, and this is some of the research that they were finding, okay? Now looking at this, these are just a few years. What I'm highlighting here is that mental health concerns are going up exponentially for our youth. Okay, they're going up exponentially, okay, for our youth, right? And what we're seeing when it comes to percent, now this is just percent change, and all of these we see an increase. So we see an increase percentage change of children who are being admitted into emergency care due to self-harm. It went up from about percent change from 2007 to 2016, we see that there was a 325% change increase in children being admitted into emergency care facilities due to self-harm. Okay? So what we're seeing is that these numbers are going up. They're going up. Okay, and so let's take even a deeper dive, and we're seeing an increase in substance use disorder for our kiddos. Any mental health disorder, a percentage change almost 25% from 2016, from 2007 to 2016. Come on, there is a crisis in the village. Come on now, there is a crisis in the village, and the reality is that the kingdom has the answer. The reality is that God has the answer. And I tell you, there has been such a spiritual attack against family during this season. Oh my goodness. Oh my goodness. Okay, so let's keep on moving, because I don't have that much time. I want to definitely honor the time. So now let's look at it in the context of family structure. All right. Now, as I said before, regardless of anyone's marital status, we want the same for our kiddos, right? We want our kiddos to thrive, but sometimes the emotional resources at our disposal, or even the social resources at our disposal, and even sometimes the financial resources at our disposal can be impacted based on having that support from a loving marital partner. And so we do see, with respect to single parenthood, it can potentially serve as a risk factor for mental health problems for both the children and the kiddos. We've seen that due to it could lead to greater psychological distress and depression. But what's actually most predictive is a disruption in that family structure. Okay, and that serves as an adverse event. Okay, this is all coming from the research of the effects of family structure on mental health, this study that's noted at the bottom. All right, and it's not all disruption. So the death of a family, a death of a parent, is not going to have the same impact as if they were co-parenting, but they were living together and one parent leaves, or a divorce. It's that disruption. And then all of the changes that the child has to go through. It's all those transitions. It's the transient nature of the disruption that's really problematic for child development, because children thrive off of consistency. Children thrive off of structure. And when that structure is disrupted, that is a trauma for that child. All right, and we're going to talk about that in just a moment when we go a little bit more deeply into adverse childhood experiences. Okay, so let's kind of keep it moving. Let's move right along here. So now in this study in particular, they were looking at a group of 154 kind of pre-adolescent teens, right, who were admitted into a behavioral health inpatient facility. Okay, and so when they were looking at the parenting structure, the marital structure of the parents, we saw some major differences. And I want to highlight a few of those major differences based on the marital status of those parents, of those children who were admitted to that specific inpatient behavioral health facility. Let's take a look at this. Kind of almost use it like a case study. All right, so let's take a look at that here in the next slide here. Okay, so interestingly, for those 154 children, only 11% came from intact families living with both their biological parents. And 89%, almost 90%, has some form of disruption in their family structure. It's the disruption family. And 2/3 of those children were exposed to some type of trauma. See, here's the thing, is that the enemy wants to remove the protection of what that foundation of both of those parents working together, how that protects that child. He wants to remove that. And he's doing everything to say that, first of all, marriage isn't even significant. Come on now. That's the narrative that's running around, that's rampant, right? And so, and also too, we see that there's a higher likelihood of experiencing trauma for children who come from children who are not living with both of their biological parents. All right. So with that being said, if there's a higher likelihood of that trauma being introduced into their lives, what does that mean? We're going to take a deep dive into that just right now, okay, and looking at adverse childhood experiences. Okay, so let's take a look at what are ACEs. So Kaiser Permanente, in conjunction with the CDC, they conducted a study to see how adversity during childhood, how does that impact not only mental health, physical, mental health and maybe risk-taking behaviors, but how does it even impact these children's life expectancy? How does it impact even their likelihood of getting cancer, diabetes, and a host of diseases that we wouldn't even think would be connected to adversity during childhood? Because what we see is that it depresses the immune functioning, family. And so here's the thing, is that the enemy does not fight fairly. And he understands that childhood is a very impressionable time when it comes to development. And if he can throw things off course early on, he's banking on it staying that way. But thank God for the redemptive work of Christ on the cross and neuroplasticity of the brain. But he wants to shape the brain by trauma early on. And he wants to plant ungodly seeds in that child's brain based on those experiences. So by very definition, an adverse childhood experience, an ACE for short, those are potentially traumatic events that occur during childhood, right? 0 to 17. It could be experiencing family violence, abuse. It could be neglect, witnessing violence in the home, or having a family member attempt or die by suicide. But not only that, is that the context matters, right? So when we're thinking about it from an ecological framework, and all ecological framework is just a theory that says that context matters, the environment matters. That's all it says, all right? And so also included are aspects of that child's environment that could undermine their sense of safety, stability, and bonding. So things such as growing up in a household with substance misuse, mental health problems, or instability due to parental separation or incarceration of a parent, sibling, or other member of the household.